Since the inception of this administration, promises have been made to renew hope and restore trust in government. In line with the renewed hope agenda, the federal government, through the Central Results Delivery Coordination Unit, launched the Citizens Delivery Tracker, which is a civic tool designed to aid citizens provide feedback on public service delivery, with the aim to bridge the gap between citizens' realities and institutional actions. But the question looms: do citizens know this tool exists? Are they aware that they have the power to give feedback and hold the government accountable? Let's find out.
The Citizen Delivery Tracker, which is an app that has been developed by the Central Result Delivery Coordination Unit, it is more of an application that is to be used to track the performance of government project policies and programs by citizens. It is meant to give citizens a voice so that government can receive feedback from them in terms of the projects and programs of MDS.
Public officials are there at the mercy of the citizens. We do implementation of policy programs and projects of government in order to benefit the citizens. And of course, we want a situation where the public will be able to engage with the government. And when they engage, we'll be able to have insight into the expectation of the citizens. So that is why the citizens are very, very important. And in order to have robust engagement, the CDT was developed to ensure that the citizens have input on what government implements.
It's a technology we've designed and developed that allows any person with a mobile device and internet to be able to track progress of the government and things government are doing in terms of initiatives, projects, programs, and whatsoever have you.
This is my first time of hearing it.
I've never heard about it.
No, I've not heard of it.
Natabaji.
No.
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 I heard of that today.
Yes.
I've not heard about that.
No.
I've not heard of it. I haven't.
No.
No, I haven't.
This is my first time.
I'm just here to introduce you to a certain platform called the Citizens Delivery Tracker. It helps citizens give feedback on public service delivery.
Government has built the hospital for us, but there's no facilities, no equipment.
These markets have been expecting a pedestrian bridge. So when the dualization came, we thought that the pedestrian bridge will be built with immediate effect. But unfortunately, they finished the road, put pillars for the pedestrian bridge, but they didn't do the pedestrian bridge up till now.
I have a serious problem in my community, which is light.
We are suffering for water and light.
We are not being protected. You plant something and somebody else will go and destroy it. Sometimes when you complain, nothing will be done.
And most times the building in itself is not accessible because when in a place where they have stairs, it's not color coded. So I find it difficult navigating through or climbing the stairs.
We need nurses here and midwifery, that the one that they will take care of aspect of labor, and we also need doctors.
Okay, sometimes we have some transportation issues. My faculty is quite far from my hostel. Sometimes we don't get keke to go to the faculty, and even some inadequate hostel facilities as well.
Sometimes before going to farm in the morning, they have destroyed our crops.
The strike has really affected some things. Then the water system sometimes is irregular, and sometimes the light.
Spike in prices of transportation, it has been something that has affected the students, especially me.
It's not easy for me to access public buildings because it's not accessible. The universal design, constructing all these buildings and roads is not inclusive.
The ministry has established a structural response framework for all complaints received through the CDT. And on the receipt of a complaint, the service delivery unit reviews such complaints and escalates them to the appropriate department or agency across the value chain of the sector. We have the generation, the transmission, and the distribution. So such complaints that are related to any of these value chain will be treated accordingly by the relevant department or agency.
We in the ministry receive reports from every department monthly and from every agency on their activities and on their interface. There are issues that are normally escalated. There are issues that agencies handle or departments handle. There are issues that are escalated probably to the permanent secretary or to the minister.
Any complaints or question from the public comes to us through the CRDCU, and as soon as it gets to the ministry, we try to act on it swiftly and then report back accordingly to CRDCU.
You see, the feedback we used to have in the ministry, particularly when we organize citizens engagement, we don't have much challenges in responding to them, because there and then it's not something. Minister is always heated when we have that public engagement, and minister responds accordingly. But in addition, we equally harvest those feedback, and it helps us in attending to other issues pertaining to the citizens.
We have a department of reform coordination and Savicom, and they attend to all the complaints, not just the ones brought about or brought in during the citizens' engagement, but every day, you have one complaint or the other, and the reform coordination department is there.
We've been engaging with the citizens through this whole delivery process since it started, and we've had series of avenues that we've tried to use to engage the citizens and as a way of showing transparency and accountability.
We also track these complaints, as they come in, and then we look at the agencies or the departments that the complaints lie within their purview to deal with, and we escalate. So what we do is we, as much as possible, try to do that within 48 hours. Once we get a complaint, we see that we respond within 48 hours.
Who do you report to? In this market, we only know Buhari Area Council that comes to collect their revenue and go back.
I wrote to the area council, I wrote to the office of the minister of FCT, but yet no response.
Who do you want to report to? You don't know where to report to now. We never report to anybody.
We have tried to complain to our people, that is our leaders in the government, but since nothing has been done.
We have reported this to AMAC.
There's nowhere to report. There's no proper reporting channel.
We have cried out. Nothing is happening in my community.
Muna complain, Bazamuji answer by especially school.
The first challenge is that many of the complaints received through the CDT are related to the distribution companies. And these discos, we know, are private operators with oversight functions by the sector regulator. Therefore, the resolution often requires multi-agency coordination. The NERC has to oversight such complaints to enable the discos address them. We also have infrastructure and funding constraints, which lead to delay in the resolution of some systemic issue. So to address this challenge, the ministry has strengthened interagency coordination, improved data tracking systems, and aligning reforms to improve sector liquidity and infrastructure investment. The goal of this is to reduce the recurring complaints by fixing the root causes.
We deal with patients mostly. So at the primary healthcare level in underserved areas, when people do not get the quality care that they deserve, how do they use this system to reach out to us? For those who don't have access to electronic medium in areas where people don't have access to data network, is this system able to collect data offline? Or how do we even get them to join this process?
The challenges is that we don't have direct access to the back end. As I earlier mentioned, is the CRDCU that has to tell us whatever the challenges are, then we take care of it and then get back to them. So I think essentially that's the challenges we have, where I don't have direct access to the back end.
Sometimes we get these complaints and then escalating it or getting it to where it will be solved, takes time. you know, sometimes you don't have the right person to deal with it. And these are some of the challenges, and also the expertise to deal with it immediately. You know, sometimes we need to go through and verify some of these complaints to ensure that they are actually, you know, genuine.
Internally, I think at times the problems people have or citizens have, at times their questions are not well structured. At times, you know, their questions too may not be something we could directly respond to. So we might need to liaise with the relevant agency involved to get the feedback. And at times, even the relevant agency, there might not be a desk officer that could readily respond to those requests. So it will create a kind of, you know, time lag, unlike where you just have an immediate response to those inquiries.
We have some ministries that are very large, and by largeness, we mean they have many agencies and departments. So coordinating among these departments in generating data and updating same on the CDT, you know, can be very, very challenging. And, you know, lastly, one of the other key challenges is capacity gap. Of course, there are new improvements, new issues. So it takes time to train officers on the desk in order to ensure that proper report is, you know, uploaded on the CRDCU portal, and by extension, the Citizens Delivery Tracker.
For operational, one of the things is how to get accurate data from the ministries. You know, when this app was developed, it's expected that in the course of tracking the performance of ministries, that the MDAs will provide their data so that the CRDCU can upload such data into the app. And for us to do that, we need to verify those data, because we don't just take the data as they are from the MDA. So it becomes a challenge on how we can manually or scientifically or electronically validate those submissions. There's also the challenge of citizens who may live or stay in rural areas. The use of technology is a big challenge, because projects are not implemented just in urban areas where you may have people that have access to IT tools. But we also take cognizance that there are projects that are in the rural areas, and the necessary IT infrastructure may not be there. So it becomes difficult for citizens in those localities to send their feedback. So it's a major challenge that we are also looking for ways on how to address it, so that we can also receive feedback from citizens in the rural areas.
Things have changed for the best, because actually our upkeep is helping, and the school fees that NELFund is helping us with is actually also helping, because last semester I was not able to pay my school fees on time, but because of NELFund I was able to pay it on time.
It's been able to help me pay my school charges with ease without having to worry or disturb my parents about it for the meantime.
Since I got the loan, the spending pressure on those taking care of me has been able to reduce, and it has helped them in a lot of ways, so that they can put the money in other things.
It has helped me quite a lot in some aspects of my life as a student. It covered some bills that I had to settle myself.
Things have really improved from my transportation. At least I've been getting support. When I received the loan, my transportation became more flexible and easy for me, and other things like my feeding and one or two things that I have to do. The loan is helpful. I've gained more from it.
Yes, it gave me confidence, because at first I was afraid of the whole process. But I want to appreciate the government for giving us the chance to be able to apply and receive loans for our academic purposes.
Yes. I'm very confident about it.
Yes, it gives confidence that students can access government programs, because the process in getting the loan was easy, and it was reliable too. It's reliable.
When I was applying for NELFund, I thought it was a scam, but it wasn't. After applying after 2 months of applying for Nile Fund, I received my first upkeep, followed by the school fees I applied for. So actually, the initiative that President Bola Ahmed Tinubu brought is real, and that made me believe in any initiative that government will bring.
In terms of the hike in the price of fuel and the cost of transportation is on the high side, it's a way of kind of a subsidy to commuters because it's more or less free. We only pay from our destination down to the terminal, then from the terminal to our final destination is free.
It's really helping out and I'm really enjoying it. Entering, the free ride, the comfort, and there's no traffic. It's very, very smooth. I'm really enjoying the free ride.
I'm a copper, so and my place of primary assignment is Metroview, that is opposite Nile University. So I drop at Upa and then go to my site. So for me, it's very convenient.
If it continues, I think Nigerians will appreciate it more because I believe there are quite numbers of Nigerians that still don't know about it, especially those that lives around the areas that the terminal did not pass through. But by the time they get used to it and they adjust, I believe the population will even go higher than this.
If this thing continues, at least it will also create bond between the ordinary Nigerians and our top leaders. At least there should be something that we can make reference to and say, okay, this was made free.
It really make a lot of difference and it's really helping us a lot. See that we are family people and it's a free ride. We're really enjoying it. God bless the federal government for us.
If government can help us put toilets for market, bring more environmental that will make market to be clean. If they can help us with the water issue, it will be good.
We want water and we want light.
When there's a lot of vibrant water within the community, there will be less risks of typhoid and malaria, some sicknesses like that.
They should empower the women so that their children will go to school.
Well, carrying out the advocacy, telling people how important to make buildings inclusive, not for only persons with disabilities, for them too, because it's for everyone.
Intentionality in including persons with disabilities in decision-making processes.
So I really like them to look into the hostel accommodation and make it easier for us to be able to access.
To incorporate more citizens' participation, more deliberation with citizens across almost all of the areas. Unless citizens are consulted and citizens are able to collaborate with government on what the indicators for these priority areas are, it will almost be as if the government is winking in the dark and you think you're getting work done, but nobody is seeing you.
Okay, how it can be improved is what we are trying to do, working with Accountability Lab. How do we make citizens to be aware of the Citizens Delivery Tracker and to ensure effective usage of the tracker?
So with time, we plan to update the CDT to incorporate more data and analytic tools within it to help filtering information that we get from citizens, which makes the process faster. We get to do some analysis on that feedback and channel it to the right authorities.
I think handshake such as what we have with Accountability Lab is very key to ensuring that the bond between governments and citizens is stronger and bringing back the trust that seemed to have been somewhat not so strong, bring it back strongly. And we hope that we get more partnerships and collaborations with like minds so that the CDT can gain traction.
We would want a situation where once people are able to give their feedback, this system also tracks how we respond to those feedback so that both ends are held accountable.
So there is need for synergy, collaboration between all the MDAs, and that will help to meet up the citizens' concerns.
There's need, first of all, to do enlightenment for people especially the MDAs, ministries, departments, and agencies, to know about the CRCDU. It's only when you use it you'll be able to say, okay, this is what and what is the way it works, and this is the way the nature of improvement you expect.
Collaboration with sister agencies. We should make sure we work together so that, in a snap, we can get all the information we require easily. If that cooperation is there, collaboration, it will be easy because we have a one-stop. The CDT is supposed to be a kind of one-stop where you could go access any information on any MD. So it's based on what the inputs which the MDAs are making or is making that we can now, easily access the information the citizens require.
Yes.
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 Yeah. Yes.
Very,
very often.
I'm always ready to learn.
Yes. Yes, I am.
Yes, I am.
Yes.
I am.
I'm open to learn.
Of course.
Yes, I'll be willing to learn more.
Yes, I am.
Yes.
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 Yeah, I am.
I am.
I would love to try that out.
This government is keen on ensuring inclusivity for citizens. So every citizen must see it as theirs. It's like government empowering the citizens to give feedback on what they have promised them to do.